Hi everyone, today I wanted to talk to you a little bit about what a pelvic health physiotherapist does. It's a lesser known branch of physiotherapy. Most people think of physiotherapists as treating knees and backs, necks, but we also treat the pelvis. And there's a special branch of physiotherapy that works with dysfunctions in the pelvis. So what to do, I'm going to talk to you about what we treat and how we go about it. So the sorts of things that we treat is probably the most common one that everyone kind of associates with a pelvic health physio is incontinence. Now that might be bladder or it might be bowel. We also treat prolapse, so that's where you get a bit of a descent of the bladder or the bowel into the vagina. And we also treat pelvic pain, which is a lot more common than I think people realise, and a lot of people don't realise that us as pelvic health physios can make a huge difference to people with long-standing pelvic pain. The other group of people that we treat is pregnant and postnatal ladies. So we treat people with pregnancy-related pain, and then postnatally we also do body checks. So you might have heard of the mummy MOT. So after 6 weeks postnatally, we can do a check to see how everything's functioning, not just in the pelvis, but full body check. Make sure you're okay to go back to exercise. You can look up more on that on the website. And then we also, as part of that, check the tummy. So we're looking for tummy gaps. And so we can treat that as well. And we also see people post-gynae surgery and help people with their recovery. So is it all about the pelvic floor? No. So yes, that is part of what we do. Absolutely. It's a huge part of the pelvic anatomy that we can affect because we have control over it, or we try and get control over it. But we take a full body approach. So just like any kind of dysfunction that you might have in the body, anything related to the pelvis can also be related to other systems in the body. So your bladder, your bowel, it could be related to pain elsewhere. And so we try and listen to your story. We listen to your problems and we take a full kind of body approach, and then we'll kind of build a picture of what might be driving the symptoms. We kind of take time to really understand, and more importantly, listen to you about what you want to do. So listening about what your goals are, what you want to achieve. And that might be different for everybody. And then we come up with a plan of how to manage that. And that might involve some exercise, it might involve some pelvic floor exercises, but it might surprise you to know that we might give you other exercises as well. They might be stretching, it might be breathing, it could be strengthening other areas that mean that you're overloading the pelvis. So there's lots and lots that we can do. The other thing that we can do is give you advice on other things which might help, so like toileting, also different products that might help, medications, and linking you in with other healthcare professionals that can also support you. So it's not just about the pelvic floor. We're not just a one-trick pony and treat leaking. We treat lots of different things. Take a look at the website on the pelvic health page to check what we do and how we do it. And if you've got any questions, just let me know.